Gastric band surgery involves taking a ring of silicone, wrapping it around the top of the stomach to form a small pouch that has a volume of 50 mils. This dramatically decreases the amount of food that can be eaten. Unfortunately, however, gastric band also dramatically decreases the type of food that can be eaten. And a lot of patients with gastric band have trouble with fibrous food, meat, bread, rice, pasta. They find that it can stick in the pouch above the band, and occasionally they regurgitate it back up. So although the band is the safest of all the weight loss procedures, as there is no stapling or cutting of the stomach, it has really fallen out of favour because of the poor quality of life associated with gastric band. So again, there's 4 little cuts the size of my fingertips. The band is placed around the top of the stomach and it's sutured in place. The patients would go home the same day and they would go back to work after 2 days. So it's a very quick, very safe and very easy procedure to perform. Patients afterwards would be on 2 weeks of a liquid diet and then 2 weeks of a baby food diet. But as I say, the band is rarely performed these days, mainly because of the poor quality of life and also because of the weight loss associated with it. It's not as good as the other procedures. A lot of patients, due to the quality of eating and quality of life that they do not enjoy with the gastric band, eventually have their band removed. Removing the gastric band is done as a day case, so the patient would typically come in the morning. 4 cuts that they already have in their tummy from the insertion of the band would be used. They would go home in the afternoon and they would return to work the next day. So the removal of the band is a very simple and easy procedure to perform. It depends on the weight loss of the patient. Band patients can lose reasonable amounts of weight, and it depends on where the patient's desired weight is. The older the patient, the happier they seem to be with a higher weight, whereas the younger patients tend to want to push and get down to a lower weight. So it depends on each individual patient. But yes, there's a lot of band patients who have the band out, are reasonably happy with where they are, but within 12 months, sometimes they slip back into bad habits and are back at the practice looking for a more permanent way for them to lose weight.